Jorge Rodriguez, who is the Office of Emergency Management Coordinator. Mayor, I open the floor to you.
Good afternoon. Thank you for joining us today. I would like to start off today's meeting with the announcement of Ms. Angela Mora being named our new Public Health Director. Congratulations. Ms. Mora is an El Paso native and has over 30 years of public health experience, serving in various roles in the healthcare sector. For 7 months, she has worked very closely with the emergency operations team, including Dr. Ocaranza and me, to address the public health needs of our community. I am pleased with city management's decision to promote Ms. Mora. It is very well deserved. There's a formal press conference, press release going out, going through the process of the nationwide search we did, how many were there, and the fact that she stood out above all. Congratulations, Ms. Mora. This morning, we announced a record number of COVID positive cases, 523 with 4 new deaths. Hospitalizations, we were very concerned about the hospitalizations and what this means to our community as a whole. It's very concerning. The spike is not attributed, I repeat, this spike is not attributed to the recent Labor Day holiday. This is simply due to community spread and letting our guards down. I have said before, and I will say it again, without a vaccine or medication to treat COVID-19, it is critical that we wear face coverings, social distance, and wash our hands. We must take care of ourselves so we can take care of each other. As we continue to balance our health and our economy, we must be responsible when we are leaving our homes. We have done contact tracing, and the results we have so far are related to information that Ms. Mora will share with you specifically as to what we're seeing. This information drives the decision-making and the guidance provided by the Public Health Authority. I want to clarify, there still seems to be some confusion. Schools are not operated or managed by the city. They are independent entities. We have provided guidance to area schools, but the ultimate decision is up to each of our schools' leadership. With today's spike in cases, I want to remind everyone that Halloween masks do not replace face coverings, which will help prevent the spread of virus. I know this has been a difficult time for so many, and there is an urge for a sense of normalcy. So I encourage you all to be creative this year and celebrate within your own homes to limit the spread and exposure of COVID-19. Should you choose to celebrate outside your home, please consider drive-through trunk-or-treating options or things that are protective and will not add to the spread. With that, I'll turn it back to Laura.
Thank you, Mayor. I'm asking Ms. Nicole Reese to please join us at the podium. And Nicole, if you could introduce yourself and spell your first and last name for us, just in case, for media.
Good afternoon. My name is Nicole Reese. I'm the Public Policy Analyst for County Judge Ricardo Samaniego. The County Judge says his regrets as he was unable to be here in person with us today. He tried his best to be present virtually, but he is having some connectivity issues. So I am going to go ahead and read his statement on his behalf. Yesterday, Governor Abbott announced that effective October 14, 2020, some businesses may open to 75% capacity and bars may reopen at 50% capacity if areas do not have high hospitalizations. The governor stated that county judges across Texas will have the option to opt in their county into opening bars as long as they assist in enforcing health protocols. Per the governor's order, high hospitalization is defined as an area with 7 consecutive days in which the number of COVID-19 hospitalized patients, a percentage of total hospital capacity, exceeds 15%. Further, if areas exceed total capacity by 15% or more, bars and similar establishments are not permitted to reopen. If areas report below 50%, the county judge may make a request to 2ABC to allow bar reopenings. Although El Paso County reports 14% hospital capacity, the region reports at 13.9%. We are at a critical juncture in our community and cannot afford to allow the infection rate to increase. Unfortunately, the group with the highest percentage of active COVID-19 cases are young people between the ages of 20 to 29. Opening bars in El Paso will only further increase the positive cases in this age group. I will be making a final decision in the coming days based on the information I receive from our local health authority, Dr. Hector Ocaranza, other respected health officials, and input from our federal, state, and local elected officials. Of course, I will be talking to Mayor Margo, who I have a very close relationship with, as we have been working side by side for the past 6 months. Rest assured that I intend to make a decision that is in the best interest of the community based upon the scientific data concerning COVID-19 in our region. Our office will be coordinating a press conference in the coming days, and of course, we'll be sure to keep you all updated. Thank you.
Thank you, Nicole. Now I'm going to ask Ms. Angela Mora, who is our newly appointed Director for Public Health, if you could speak to us with regard to contact tracing.
Yes, of course. Good afternoon, everyone. First, I would like to take this opportunity as my first day as the Department of Health Director to thank all the members of the media for your support throughout the pandemic. Since March 17th, you've been very close partners with us, and we really value your support. So I would like to, Mayor mentioned some of the challenges that we've had with contact tracing. So I would like to first tell you that since the onset of the pandemic, our contact tracing team was small, but we have been able to increment to almost a team of 300 contact tracers. That includes epidemiologists, investigators, data managers, and so on. So we are extremely well equipped to respond to any number of positive cases that we have in the community. Unfortunately, as the pandemic progresses, we are experiencing some challenges in reaching out to people. We have individuals that we are calling, trying to contact them to place them on isolation or quarantine, and they either don't answer the phone, we call several repeatedly, they hang up on us, they tell us bluntly that they are not interested in following any quarantine orders, isolation orders, they hang up on us. So it's been, as the pandemic progresses again, it's been very challenging, and we need to ask the community to work with us for us to be able to put an end to the spread of this pandemic. We see as a fact that we've had the cases on individuals under the age of 40 up to now, it's 54%. We did an analysis for 2 weeks of the data, and we found that in 2,830 cases reported in a 2-week period at the end of September, from September 17th to the 30th, we found that almost 14% of individuals that were reported positive have traveled. So we know that travel is a factor in the spread. We also saw almost 14% of them, they reported to have visited stores of all sorts, could be grocery stores, department stores. We had almost 13% are students or daycare employees. We have almost 8% of individuals who reported to have gone to eat at restaurants, so that's another potential source of this spread. We had almost 6% of individuals that reported having attended family reunions. We had a small percentage, which is almost 3%, that attended large gatherings. 0.95%, they declared not to have been wearing a mask. 2.3% for those who like to go to gyms. Those are the only ones who reported having been to a gym. And 0.6% attended places of worship. So we have, again, a lot of challenges, although we have such a tremendous capacity to respond and contact trace a large number of individuals in the community. We are seeing, we are being unable to reach all the people that we want because the individuals' unwillingness to respond to us and work with us. So we are calling to the community to help us, to work with us, to give us 15 minutes of their time. When the investigators call, we need for them to answer and give us 10 to 15 minutes. There is a set of questions that we ask from the individuals, and this is very important because that is going to help us identify any other individuals who were exposed and who need to be placed on quarantine or perhaps asked to be tested, to put people at home for a few days so that we can stop this. We have cases in which individuals receive their test results, positive test results from the laboratory, and we don't receive them until later. We ask that if any individual receive their laboratory results and we don't call them, they don't hear from us, or maybe they don't answer the phone, to call us. They need to call 212-6520 to let us know that they have the positive results and to receive instruction for us. Again, we're asking people to give us 15 minutes of their time and to follow the orders. One measure that we're taking right now, because we're seeing these kind of challenges, is we are sending, if the individual doesn't respond, we have the contact information with us. So we are sending a team of officials to deliver a public health order in person to those individuals to ensure that they are following the isolation or quarantine orders. So if you don't respond, very candidly, I'm telling you that you're going to have a visit from a law enforcement officer and a public health official. So please answer and help us stop the spread of the virus. We can do it together. Vaccine is almost here, so we just need to work together for a few more months to defeat the COVID-19 in our community.
Thank you, Ms. Mora. And now I'd like to ask Assistant Fire Chief Jorge Rodriguez to please join us at the podium and discuss the additional testing as well as compliance.
Good afternoon. So I'm going to be covering testing, compliance, and also the flu vaccination program that we have ongoing for the last 2 weeks. So starting with testing, one change in scheduling for tomorrow at the Student Activity Center. They'll be operating from 12:30 to 5:30. All the other state sites will remain their normal operating hours, so please visit epstrong.org to look at the available locations where you can get tested. There is a very high demand in tests. Yesterday was our second highest day of testing on record. We came very close to 4,600 tests for a single day, so there is a big demand. The state sites are doing very well. The wait's a little bit longer, but it's not too bad. Right now, each state location for the mega sites at the Student Activity Center and at Valle Verde have a capacity for 1,000 tests per day. So we still have room there, and also the nation's Tobin location is up to 500. So plenty of capacity. The city sites are still operating as normal. We have about 800 capacity between both of them, so we continue to ask you all to continue to make your appointments for the city sites, and then again the state sites are appointment free. For compliance, so we are looking at augmenting our teams between the El Paso Police Department, Health Department, and the Fire Marshal's Office to continue to provide compliance efforts for local businesses. We're going to be doing some additional evening hour and weekend tours of various businesses. We want to make sure that the orders are being taken care of and are being applied within each business. For the flu campaign, we've hit right as of yesterday. We have a few activities that occurred this week. We are at 7,200 vaccinations. Again, we've done very well. Normal years, we've averaged between 3,000 and 5,000 between City of El Paso programs, so we've already surpassed that. So please go to the powerflu.com website for additional scheduled events, and that's open for anyone that is 6 months and older. So please take advantage of all these programs, continue to get tested, and we'll leave it at that. So thank you.
Thank you, Jorge. And once again, those addresses are epstrong.org for information as it relates to COVID-19, and bpowerflu.com for any information as it relates to the flu vaccine that we're providing. I'd now like to ask Dr. Hector Ocaranza, our City County Health Authority, to please speak to us with regard to the testing. I'm sorry, the numbers.
Hi, good afternoon. We're going to give an update on the situation of the COVID-19 in our city and the county. And as we have already seen, we have a very sharp increase that hasn't stopped. That started approximately 10 days after Labor Day. And as Mayor Margo mentioned, now the spike in cases is not due to Labor Day. This is mainly community spread. And that's what we're asking the community to make a greater effort and not fall into the COVID fatigue. We all need to get into work. We all want to get back to normal life before the pandemic, but unfortunately, that is not going to be the case. But we need to be conscious and we need to be aware that it takes all of us as a community to be able to pull us through this pandemic in a better and a more successful way. We understand and we know that the younger the population, the less severe the symptoms, but nonetheless, there's some children and there's some young adults that can also suffer very severe complications from COVID-19. And unfortunately, all these young adults and young members of our community are the ones that are bringing the virus to those that are considered to be at risk. And those are the ones that are coming into the hospital, and it's becoming a very serious situation, as Mayor Margos has mentioned before. We can see that the population between 20s and 40s are the ones that comprise approximately 40% of all the positive cases that we have seen. We continue to see that rise, and it is very concerning how the numbers are staggering and continue to climb up. We are very happy to see that a lot of people are coming to get tested, and we need to encourage everybody to come and get tested with or without symptoms. If you felt that you've been exposed, please also come and get yourself tested. If, as mentioned by Ms. Mora, you don't get the call from the health department, you know that your result is positive, please call us. And it is extremely important that to stop the spread of the virus, we need to remain in isolation and quarantine. Isolation and quarantine is one of the methods that we have that is going to help us stop the spread to others that are susceptible, and we'll be able to keep our loved ones safe. As we move forward in our dashboard, we can see that our positivity rate has climbed out to 12.1%. It is very high and continues to climb. Our number of positive cases per 100,000 population has reached 37, which is also very concerning, and therefore we need to continue inviting the community to take self-responsibility. Being self-responsible for ourselves is going to mean that we're going to be responsible for others. So if we take care of each other, we'll be able to do better. On the hospitalizations, we see that we have reached the 14% of COVID-19 patients within the hospitals and continue to see an uphill climb of the hospitalizations related to COVID-19. Unfortunately, we continue to see that the older the population, the more likely it is that they're going to be hospitalized. And unfortunately, after the hospitalizations, we start seeing that people die from complications of COVID-19. We have our respiratory viruses coming, and they're upon us, and one of those during the flu season, we have the influenza, we have the RSV, we have many other respiratory viruses that are going to be having the same symptoms as the COVID-19, and the one that we have a way to prevent is the influenza. Please go get your flu shot. Chief Rodriguez had mentioned how to get information and how to get your free flu shot. If you're 6 months and older and you have no contraindications to the flu vaccine, please go get it. That's part of the responsibility that we need to take for ourselves and for others as well. On the mortality rate, we continue to see that it is climbing up, and the vast majority of the people that die from COVID have pre-existing medical conditions. We're disproportionately affected by the fact that we have a lot of members of our community with diabetes, high blood pressure. Many people do not have access to health care, either economic reasons or some other social determinants of health. And we know that, especially in parts of the county, there are multi-generational homes that have a lot of our grandparents, great-grandparents that we're taking care of, that we need to continue taking care of by keeping them safe, by not creating opportunities to be infected with the virus or have those opportunities to spread the virus to those loved ones or bring them home. We need to make sure that they have enough of their medication, and if they haven't been able to go get their medical provider exam, please take them. That's also very, very important. If we're healthy, if we're eating healthy, doing exercise, we'll be able to fight the virus in case we get infected. But it is extremely important that we prevent the infection of the virus. A lot of the people, again, are getting COVID fatigue, but we need to all do our part. What are going to be the next steps that we need to take? We've been working very closely with the schools, and as Mayor Margo said, we don't order them, but we continue providing guidance and recommendations to them in which they're going to continue to provide a safe environment for the students, teachers, and staff alike. In regards to the sports, we have put out some other guidance and recommendations, but by the orders of the governor, they are allowing the sports to continue, and we cannot contradict the orders of the governor, but we definitely put some recommendations, and some of those recommendations that we did at the city parks and recreations is that there's going to be allowed only one parent per player, but no spectators for the adult sports. We need to make sure that we follow those rules. If we can send our child with some other team member, or make sure that if you go to those games, wear your face covering, observe the social distancing, and please observe also the other hygiene measures that we've been mentioning over and over and over. And with that, we hand it over to Laura.
Thank you, Dr. O. And now we're going to open it up to media questions. There are a number of media questions that came in during the presentation, so I'm going to start off with the first question that we have via the internet, and the question is, with the recent games that have been canceled due to positive COVID testings in schools or teams, is there a chance for you, Dr. O, that you might order the school districts to cancel their fall sports? And you spoke a little bit about this, but if you can repeat your response.
I would like to repeat again that we cannot control, but we provide guidance and recommendations, and as the conditions become less favorable, that might be one of the options that could be suggested, along with some other recommendations that have been brought in to school officials. We continue to meet on a regular basis with superintendents, school nurses, and they're working very closely one another. And also, we have reiterated our commitment to continue working with them and continue providing those guidances and recommendations. But it's ultimately the decision of their superintendent and the school board to take those definite decisions.
Thank you, Dr. O. The next question is also for you, Doctor. Will you be asking the El Paso Locomotive FC to not host fans this weekend because of the rising case in numbers. Currently, 1,600 fans are expected to attend Saturday's match at Southwest University Park.
Well, as I mentioned a little bit ago, governor's orders can allow professional sports to take place, and the Locomotive organization has been very responsible, and we're confident that they will continue being responsible in the way that they conduct their sports and allow their spectators or not allow the spectators, but they have been able to enforce all the health protocols that have been recommended for the city and the county.
The medical journal, the New England Journal of Medicine, said Trump's administration took a crisis and turned it into a tragedy. Do you think, Dr. O, that medicine and politics should be mixing during this pandemic? What is the impact?
Well, I believe that there has been expertise in both areas, in the politics and in the public health. And one of the greatest strengths that we have locally is that we take the decisions together based on the available data that we have, and we've always shown that we are working together in between the county judge, mayor, and public health.
Ms. Mora, can you expand again on the cases that were investigated in the last 2-week period for contact tracer? Can you repeat the list of percentages for media?
Yes. So I said that, get it closer, okay. Is that better? So I mentioned that we did an analysis, and we're doing more analysis from here on, that we had identified 2,813 cases reported between September 17th and September the 30th. Almost 14%, to be exact, 13.75% reported having traveled. 12.5% of them are students or daycare employees. 13.82% reported having visited stores, grocery stores, department stores. 26%, they attended family reunions or small parties. 5.26% reported attended family reunions or small parties. 7.25%, I think I mentioned this already, went to a restaurant. 2.40% attended large gatherings. 0.95%, they reported not wearing a mask. 0.6% attended places of worship. 2.3% attended gyms. And that's all the numbers that I said. I also said that 54% of all cases are within people under the age of 40.
And can you repeat the number that they can call if they needed to call for contact tracing?
Yes, so if, what I said is if anyone receives the results directly from their laboratory where they tested and have not received a call from the Department of Public Health within 24 hours of having received the results, we need for you to contact us at 212-6520. The hours of operation for this triage center are, we open 7 days a week from 7 a.m. to 7 p.m.
Thank you, Ms. Mora. We now open it up to media in attendance. And if you could repeat the question.
Yes, the question is for Dr. Carranza and myself to explain our different roles. So the role of the health director is to administer the health department to administer all the programs, finances, public relations, relationships with the public on an ongoing basis. We have approximately 20 different programs, 15 program managers. My role is also, the role of the health director is also to supervise, to empower, and to oversee all the operations in general. So I'm going to ask Dr. Carranza.
The role of the health authority is serve as a duly licensed physician in the state of Texas, as mentioned in the Texas Administrative Code, and which we administer and make sure that the population is being healthy, that we impose quarantine and isolation orders if there's a communicable disease threat, and support the operations of public health.
For clarification, the bottom line is the role of Ms. Morrow will never be the role of Dr. Carranza. It is a bifurcated, separated priority.
Is there any data on how many violations were issued for restaurants or bars or kitchens that were out of compliance? And then also, there were earlier concerns about contact tracing, people coming back and forth and all that sort of stuff. Obviously, the work has been targeted by CDC. Is that still a concern, or I mean, has it proven to be that that's not a major concern about transmitting?
So the first question for those of us joining us virtually, the first question was with regards to the compliance, if there's any breakdown in terms of the numbers of folks who have been cited or given warning as it relates to restaurants or bars or kitchen that were allowed to reopen.
So we have on the epstrong.org, we have education and enforcement, and there is a database that captures all of the various businesses that have been cited. But just some high-level numbers, our COVID compliance task force from the Fire Marshal's Office and Health Department, they've issued 145 citations. The El Paso Police Department has done 12. But there's a breakdown and there's a spreadsheet there that's available for the public to look at the various businesses that have been cited. Of course, and if there's any compliance issues, you can always contact 311. There's also a non-emergency available on epstrong.org, but please visit the website. If you have any concerns, at the bottom of the page, there's information on how you can report compliance issues.
And the second part of the question was in regards to the traveling back and forth between the border towns. And it is a unique situation that we have in our community in which the people many times live in one side of the border and work in the other side of the border, or we have family, extended family in both sides of the border. There's always that concern of people traveling back and forth to different houses, relatives, and different households. The same way that if we have people go and visit some other relatives within the same city, there's always going to be the possibility that if somebody is susceptible, they're going to be bringing the virus and it's going to be transmitted to other members or people at work as well.
And to the question with regards to enforcement, if you go actually on the city website there for EP Strong, under the health orders, you have the listing for education and enforcement that list specifically details regarding the violations and enforcement.
Yes, sir. Bueno, la pregunta es de qué es lo que vamos a hacer ahora que el gobernador ha permitido abrir los bares. Y la respuesta es de que la decisión de abrir los bares o no va a depender del juez del condado, y el gobernador dio esa opción de que el juez del condado puede optar a abrirlos o no abrirlos. Esa decisión, como lo hemos oído por parte de la oficina del juez del condado, va a ser una decisión que se va a tomar en conjunto con el alcalde Margo y el Departamento de Salud Pública. En la manera que estamos viendo los números en este momento, no creemos que es una decisión favorable el abrir los bares en este momento debido a todo lo que estamos viviendo.
¿Y qué es la posibilidad? ¿Qué es lo que puede pasar si toda la gente se comienza a juntar?
Lo que ha pasado, y ya lo vimos con anterioridad cuando se abrieron inicialmente los bares, es de que en los bares la gente no usa su cubrebocas, no observan la sana distancia o el distanciamiento social, y con una persona que vaya y tenga el virus puede exponer a muchas otras personas, las cuales pueden enfermarse nomás por asistir a esos lugares. Muchos de estos lugares son lugares cerrados que no tienen buena ventilación, lo que propicia una infección y un nivel de infección mucho más alto, en el cual se puede propagar mucho más fácil. Y ahora, let me repeat it just in English. So the question was that about Governor Abbott's decision about opening bars, and the answer was that the decision was going to be resting county judges, and in which they're going to be looking at the local situation, and that decision is going to be locally between the county judge, Samaniaguas, we heard by Nicole Ruiz, but county judge also is going to sit down with Mayor Margo and Department of Public Health, so we can look down at the solid data that we have, in which is going to be driving the decisions that are going to be taken, but it doesn't look very favorable to open the bars at this moment, given the circumstances that we're living now. La pregunta era que si con los números que estamos reportando va a haber la posibilidad de que retrocedamos en la cantidad o en el porcentaje de que se está abriendo la economía. Y la respuesta es de que a este momento no podemos retroceder en la manera que se ha abierto la economía. Lo que tratamos de enfocarnos es en tomar una responsabilidad personal y que de esa manera podamos colaborar de manera comunidad para poder avanzar de una manera más favorable en detener la infección del virus del COVID-19. El cerrar los lugares no va a mejorar la condición si nosotros como personas no tomamos esa decisión y tomamos esa responsabilidad. And the question in English was that if, given the numbers that we're seeing right now, will there be a possibility that we're going to be going back in the way that we're opening up the businesses? And the answer was that we are not going to be going back in the way that we're opening business, going against the governor's orders, but we're trying to focus more in personal responsibility and in the way that we as members of our community respond to these. And if we move together as a whole and take our own responsibility, we'll be able to take care of each other.
Good.
At this moment, I don't have any number of cases of flu, but definitely the flu season officially starts in October, although we can see some cases of flu even before October, but that's why we are at the right time to be able to get our flu shots and prevent the complications from influenza. Hospitals and physicians or medical providers alike see a very sharp rise in visits to the offices and hospitalizations due to flu and many other respiratory viruses, but mainly the flu. And we're still seeing people dying from the flu. We hear an immense number of misinformation or different things about the influenza vaccine or the flu shot, in which none of that is completely true. So please talk to your medical provider so you can clarify all the doubts about the flu shot. You can clear all that misinformation and have a very serious discussion about the benefits that the flu shot can bring to you and to your loved ones. And there's frankly very limited amount of contraindications to receive the flu shot. So it's not an excuse not to receive the flu shot. The flu, usually in our community, peaks at the end of December, beginning of January, and usually starts going down until probably spring break in March or April.
Thank you for the opportunity to ask another question. One of the theories out there with respect to the pandemic is there's not an outbreak, there's just more testing. The more you test, the more positive numbers you're going to get. We just heard that testing, I think, hit the second highest number. Can you all speak to that? I mean, is just, more testing, more positive cases, that seems to, some people that believe that seem to think that there's not an uptick in cases, we just know about them more than there have been.
Well, definitely, and there's different ways that we need to see this. As we test more people are going to become positive, but if the number of positives was because we're just out there testing, the positivity rate that we have wouldn't be as high. It would be a lot lower because the denominator is getting a lot bigger. But on the contrary, we're having a bigger demand, but the positivity rate continues to climb up. So that means that we're finding even more people, and more people are getting infected with the virus. So it's not the more testing that we're doing. Even our positivity rate, to give you the example, before, and I have it here, and I will illustrate it here. During the CDC week number 37, our number of positive cases was even very, very, very low, and we still did not have as much testing. But as we continue to see more people that have symptoms that feel the need to get tested, and we're testing a lot more, we're definitely finding more because there's a lot more spread of the disease reflected by the other metrics that we have.
If I may add, there's also, we encourage anybody and everybody to test. There's right now almost 30% of the cases are asymptomatic. They don't have any symptoms. They test and they result positive, and they are infections and they can infect other people. So the more people we are calling on the community to test, just test. Even if you don't suspect that you were near someone who was infected, we ask for people to go and test because of the high number of asymptomatic individuals that we are identifying. So we suspect that there's more out there that are asymptomatic, that are spreading the virus without knowing. They feel well, they don't have any symptoms. People in front of them, they don't think that there's an infection around them, and that is also, we believe, causing the spread.
And the percentage is 30 from 0, not 1 3%?
Yes.
Asymptomatic?
Yes.
Thank you.
¿Podría repetir en español la cantidad, los porcentajes en donde se han infectado las personas?
Sí, con mucho gusto. Entonces, lo que yo dije anteriormente es que hicimos un análisis y estamos haciendo este tipo de análisis más seguido entre el 17 de septiembre al 30, y analizamos 2.813 casos y encontramos que casi 13.5% de los casos reportaron haber viajado. So, eso nos indica que el viajar está contribuyendo a la infección en El Paso. 12.5% reportaron ser estudiantes o empleados de daycares. 5.26 tuvieron familias, reuniones familiares o fueron a fiestas con un pequeño número de personas. 0.6% fueron a lugares religiosos, iglesias, por ejemplo. 0.95 no usaron la máscara. 7.25 frecuentaron restaurantes. 13.82% visitaron tiendas, puede ser supermercados o tiendas departamento de ropa. 2.3% visitaron gimnasios y 2.40% participaron en reuniones con un número mayor de personas. También comenté que 54% de todos los casos desde ayer hasta ayer son entre personas de menos de 40 años. Es para demostrar que un gran número de personas jóvenes, muy saludables, están saliendo positivas.
Is that it? Okay, thank you. That concludes the press conference for this afternoon. We thank everybody for joining us online as well here in person. Once again, be safe out there and always remember to wear your mask. Thank you, everybody.